When patients come to Mayo Clinic, one of the great opportunities for them is that we can coordinate their complex multidisciplinary care in a very short period of time. Sometimes patients will come with a diagnosis of multiple sclerosis. Our team will review the patient's story, the patient's neurological examination, the patient's imaging, and we may actually decide that this patient does not have multiple sclerosis. And this is not an uncommon scenario.
MOGAD, or MOG antibody-associated disease, is a new central nervous system demyelinating disease. We have many physicians who reach out to us. We really try to partner with those physicians, particularly as many of those physicians may not have a great expertise in MOGAD, and we want to help educate them, help guide the patient, and help do what's best for the patient. Because many of the MS treatments are the wrong treatment for MOGAD. I think it's extremely important to have the right diagnosis early, because then a patient knows what they have. They have an identity to their disease. It's not multiple sclerosis, it's a different condition, and we know what to expect. Our group was involved in developing the diagnostic criteria for MOGAD that was published in 2023 that gave it its own identity.
The diagnosis of MOGAD requires the presence of the MOG antibody. You don't want to be treating a patient with lifelong immunotherapy if you're not sure that the diagnosis is correct, and that's an area that we really can provide some insights.
We're also doing a lot of observational research in the field of MOG antibody-associated disease. We have neuroradiologists who are really expert in this condition, and many of us have good experience at looking at the brain, the spinal cord, and the optic nerve have been affected, and what that means for going forward.
When we're dealing with complex neurological disorders, coming and seeing a physician whose main focus, not only from a clinical perspective, but also from a research perspective, I think there's a huge gain for patients, because it makes the roadmap so much clearer if there's clarity around the diagnosis and the treatment plan.
We are learning something new about MOGAD every day. We're leading the way in much of the research in MOGAD. We're understanding what immune pathways are there, and we're developing treatments to target those immune pathways. The future is very bright for our MOGAD patients. We're going to be able to get them on the correct treatment, and we'll be able to get them the right plan going forward.